Vetoing Senate Enrolled Act 5. It's a bill which would limit the decision-making abilities of local health officials. And tonight, some of those health officials are worried about the House and Senate overriding the veto, something we saw with the governor's latest veto on a bill on his emergency powers. Fox 55's Kelsey Mannix is live tonight in downtown Fort Wayne. Kelsey, what are health officials now saying about the governor's decision?
Chris, the health officials I spoke with today are happy with the decision to veto. However, now there's a possibility that it could be overridden, and that could happen as early as next week.
This would have, put a lot more bureaucracy into how one would do local restrictions.
Allen County Health Commissioner Dr. Matthew Sutter says Governor Holcomb's veto was the right decision, especially after going through a national pandemic. Senate Enrolled Act 5 would potentially strip powers from local health officers and put it in the hands of legislators.
I am concerned that adding these extra layers to things that are happening in an emergency situation is just not the right way to go.
Co-author of the bill, Republican Senator Liz Brown, told us last month that some local health orders in response to the pandemic were draconian, and that this bill would act as a checks and balance. But Dr. Jeremy Adler, president of Indiana's State Association of City and County Health Officials, says this would slow down the decision-making process.
During a public health emergency like this, quick action is often needed to prevent disease and save lives.
Holcomb says in his veto letter that it's critical to maintain the local health expertise and flexibility needed to make these decisions.
Most people would say if you've got a choice between a doctor and a politician, you'd rather have the doctor make the decision about medical things.
Future restrictions, if needed during this pandemic, could be impacted if this veto is overridden. Sutter is hopeful that won't be necessary based on the current numbers.
So far, our cases have looked relatively good. Despite the fact that there are no local restrictions and really very minimal state restrictions.
Adler says this next week will be critical.
And really let this be an opportunity for legislators and everyone involved in these matters to take a step back and collaborate on a process to address public health concerns and public health matters in an appropriate manner.
The legislation passed 37-12 in the Senate and 65-29 in the House a couple of weeks ago. All both chambers need to override the veto is a simple majority. Reporting live in Fort Wayne, I'm Kelsey Mannix, Fox 55 News.